2018 in review. Brien Holden Vision Institute, Public Health. Our 2018's outcomes highlight some of the strategic themes we set out with at inception in 1998. We are actively pursuing vision for everyone, everywhere. More than 1.22 billion people are unnecessarily blind or vision impaired simply because they don't have access to an eye examination and a pair of glasses. To further compound the global burden of vision impairment, evidence is mounting that myopia, also known as short-sightedness, is growing at an alarming rate around the world. It's estimated that half the world's population will be myopic by 2050. Growing levels of high myopia are increasing the risks of serious eye conditions like glaucoma and cataract, which may lead to permanent blindness. Our mission is to develop sustainable vision care solutions globally to eliminate uncorrected vision impairment and avoidable blindness, thereby reducing global poverty and suffering. 89% of uncorrected vision impaired people live in low to middle income countries, which induces great economic loss. We work collaboratively to create sustainable eye care systems to increase access to affordable and locally delivered services. Both school and community outreach screenings are an essential component of our programs. Establishing eye clinics and strengthening existing eye health services are also a big part of our global work. We educate across the spectrum from eye screener to optometrist, as we believe in creating confident eye health professionals at every level. Globally, there is a deficit of eye care practitioners worldwide, needed to access vision and eye health and prescribe spectacles. We are addressing this need with our global optometry development program. We believe focused child eye health programs, when integrated into existing health and school services, can have the biggest impact on children's futures. Myopia can start at an early age, and this disease brings with it the likelihood of lifelong eye care. Through our Child Eye Health Global Initiative, our Children's Vision Campaign, we are accelerating and expanding access to eye health services to more children in more locations to screen 50 million children by 2020. Gender equity is a central strategy of our global programs, and we support gender-based innovations in a wide range of programs and locations. Policy change is enabled by consistent advocacy efforts and long-term consultation with governments and other key stakeholders. Evaluation and research. These measures help us quantify the nature and extent of vision impairment, barriers to service uptake, and the findings feed directly into our program design. Our global work this year has been greatly invested in both evaluation and research.
The past 20 years have seen a period of immense growth by the Foundation. In partnership and collaboration with many, we have been able to achieve significant outcomes for beneficiaries, but importantly also have had lasting impact that will be seen for generations to come. This year, we have continued with a comprehensive approach to our work. The development of tertiary educated optometrists will have a lasting impact in their countries. This year, an additional 380 have graduated, bringing the total to 939. Gender equity remains a critical cross-cutting issue for us. Our global program figures for 2018 highlight we reached gender parity across services we delivered and the education and training programs we provided. Our Children's Vision campaign is one of our key global advocacy strategies. This year, we increased the membership to 80 partners, and together they've screened 9 million children. Since 1998, the Brien Holden Vision Institute has delivered eye care services to over 10 million people in 60 countries, dispensed more than 2.8 million pairs of glasses, and established over 400 vision centres or sites for eye care worldwide. We've also trained over 160,000 personnel around the world. None of this would be possible without the generous support of donors and funders, our fantastic partners, and our passionate, committed, and hard-working staff. Thank you to each and every one of you. The last 20 years' work and the outcomes and impact of our work would not have been possible without the foresight, ambition, compassion, and drive of our founder, Brien Holden. We miss him, but are proud and dedicated to continue and build on his legacy of vision for everyone, everywhere.